Okay. So prior to going to the room, I would verify my doctor's order, verify the dressing change, and I would also assess to see if the patient has any allergies I need to be aware of. So then I go to the supply rooms, hand hygiene, grab my supplies. I'll grab my gauzes, my saline, my tape, my Q-tips, alcohol wipes, as well as I believe that's it, and my sterile gloves. So then I go to my room, perform my first five. So I knock, introduce myself. Hi, I'm Alex. I'm gonna be a student nurse today. I'm gonna be doing your dressing change. Provide privacy, hand hygiene. Can I get a name and date of birth? Verify with the wristband. Okay. Assess for any pain. Are you in any pain at all? No. Okay. Before we get started, do you know if you're allergic to any latex? No? Great. Okay. Pick up the bed to a nice working height for myself. I'd also have my workstation above waist level. And it's usually that's like how you would do it in the hospital, but for the sake of this video, it's stay right here. Then I'll grab my trash can and pull it next to my working station. Hand hygiene. Then I'll put on my gloves. Usually the saline wouldn't be there, but I can fit it in my gloves. Usually, or in my pocket, I mean. But it's just there for right now. So I'll clean my area with an antimicrobial wipe. And let's just pretend this wasn't here. Sorry about that. And the wipe in one way on the edges. Clean this as well. I would also be using this tape for this video. Let it dry. Take my gloves off. Hand hygiene once again. Dump gloves in trash can. Hand hygiene, as I mentioned. Let it dry, send my materials out. So I'll get my gloves. I'll get my gauze. And get my other gauze. As well as my tape and alcohol wipe. And then my Q-tips. So now I'll go ahead and set my Q-tips here on the side as I've already cleaned them. I'll open them, make sure I do not touch the sticks because those are sterile. Now I'll prep my tape. So let's say I prepped it already. Here. I'll put them on here so this is also clean. Here on the last one, I will put my name, my initials, date, and time. So now that I'm done with the tape, I'll go ahead and put it away. Hand hygiene once again. Then I'll go ahead and put on gloves. I forget about that one. So now I'll expose the dressing, being mindful of my patient's privacy. So I'll roll down the gown, or pick up the gown, expose the dressing. Okay, I'll grab my alcohol wipe. There you go. Drop in trash can. Go from the outer to the inner edges of the wound. Still be mindful of my area. Address coca. That'll be color, odor, consistency, and amount. Now go ahead and grab one of my toothpicks. I'll go ahead and take out the dressings that are already in there. Okay. I'll also observe these as well and check out how the wound is healing. I would go ahead and measure the depth of this. So now I'll go and measure. So I'll go ahead and measure over here. So I'd say it looks about like 2 3/4 centimeters. Of like 2 3/4 centimeters. And then I'll also measure the width. Looks about 2 centimeters. Then I'll go ahead and measure the length. And this would seem to be about 5 centimeters. Dispose of this. Throw gloves and trash. Still keeping an eye on both my sterile fields. And then I would hand hygiene. And then I'll get all my stuff ready to put in new gauze. So now I'll go ahead and open this up. Open it. Okay, away from me. And I'll also open this one as well. Also not hovering over the gauze. Okay. Now I'll check the integrity of my sterile gloves. See if it has not been compromised. Okay. So now I'll go ahead and open it. Or first, for my working area, I'm gonna go ahead and put this on here. This side is not sterile, so I'm gonna just put this over here. Just give me some space to work with. So I'm gonna use my borders for my gloves. Okay. Okay. So then now I will go ahead and apply this one. Back up and put on my glove and apply. Keeping it above my waist to keep sterile. I'm gonna just go ahead and bring my saline over here. Twist the cap off, put it forward. And then with it, if it was already used, I would lip it, but it's a brand new one. So then I'll go ahead and actually before I put it in this one, I would go ahead and then pour it in this one for my gauze that I would be putting inside the wound. Okay. Then I would go ahead and apply this glove. I'll go under and get it. Okay, got it. Back up again, keep it above waist level. And apply this one. This one's going on a lot easier. Nice. So now I am sterile. Still keeping my eyes on my wound area. Now I am going to move this. I could touch the center because I am sterile. I'm gonna go ahead and squeeze the excess water in the gauze. Usually when I square out on that, be mindful of not getting it splashed anywhere. Make sure everything drips inside. I'll fold it to my liking for the fitting of the wound. You gotta keep it in my hand and fold it as it creates like a chain. Again, drip all the excess water out. Now get ready to get this ready. I'm gonna get this one prepped as well. twist it. Then I will go ahead and get my Q-tip. Only one. These are my brand new sterile ones. So I'll apply my gauzes into the deepest part of the wound while not hovering over anything. Now also go from the deepest part and get the edges. Make sure that the whole wound has been secured all around from the beginning to the deepest to the other end. Still keep an eye on my sterile field. Then I will go ahead and dump this. And then I'll go ahead and grab my gauze. Place it on the wound area. I'm no longer sterile, so now it's time to apply the tape. As I'm taking the wound off, the dressing off, and putting the new dressing on, I would check to see if the patient is in any pain at all. Okay, I may not be sterile, but I can still pick up his gown. Place it all around. That's okay. Ask him now perform my last 4. Raise up secure the rails, lower the bed down. Ask him if there's anything else I can do for him. If not, I will go ahead and inform him about the call light. Take off my gloves. I will actually gather all my stuff first. Dispose of them. Take off my gloves. Then I'll hand hygiene and document accordingly.